Good morning, good morning, good morning. This is Nelly. I'm saying good morning because where I am right now, it's 6:30 in the morning. I'm about to get to work, but I have a couple minutes. I can do a quick video before I go in. So welcome back. My name is Nelly, and I know I recently sent out a very short video just to make an announcement that I'm starting this new channel called my YouTube channel called A Chat with Nurse-Nelly. So I didn't get a chance to explain what is all that about, but I can do that quick right now. So what I've figured out is that people who work in healthcare, like me, we have a lot of information. And I think we know this information and we hear about this information all the time. And sometimes we tend to forget, not really forget, but we tend not to share this information with other people. And there's sincerely people out there who may not know the information or may not know how to find this information. So I thought that okay, maybe it would be nice for my people that are my little network that I know to just share this information out with them, the little things that goes on behind the scene in healthcare, and maybe someone can learn a thing or two from whatever video that I send out. And that's why I started this channel. So I will talk about more about health. Not that I'm an expert, not that I'm a doctor, not that I know it all. No, just the little tips here and there and reminders of things that we need to keep an eye on, or things that how we need to prepare when we're going to our doctors and stuff like that. And I'm hoping that someone may learn something from that. So first things first, I wanted to talk more about primary doctor, your primary provider. I know I come from a community whereby having your own doctor is not really something that we are accustomed to. Where I come from, as many of you know or may have experienced the same thing, we go to the doctor when we are sick. We wait until we are sick, and we don't want to be sick anymore. And that's when we scramble and go to the doctor or go to the hospital, as you know, in our case. But now we're in this, where I am right now, we're in this country whereby they practice something called preventative care. I would say that I grew up in a place where we practice curative care. We wait until things happen and then we try to cure it. And as we all know, that doesn't work well. So here in where I'm living right now, we practice preventative care. So preventative care is whereby you don't wait until things happen to start fixing them. We do screening and we try and catch things at a very early stage and see how we can help, or how we can stop it from progressing, or how we can just take care of it like while in still a very early stages of the condition or disease. So that's where your primary doctor come in. So in your primary doctor, primary provider, it is that person, the doctor, who is like a gatekeeper of your health. They are the ones who make sure that every year you have something called an physical exam and annual lab. That's why I posted something like that yesterday on Facebook, if you follow me on Facebook. So on annual labs, it's supposed to be done annually, like every year. You need to make an appointment with your primary provider so they can do something called a physical exam and your annual labs. From the physical exam, that's when they do their assessment, whereby they listen to your heart, they check your glands, they listen to the way you breathe, your mobility, all that stuff. You tell them whatever is going on. Are you having enough sleep? Are you able to sleep? Your stress level, how are you managing your stress? How is your breathing? Are you feeling like you have some palpitation, like a different kind of heartbeat? Are you able to move your arms, your legs? Is there anything going on in your stomach or things like that? Or how are you moving your bowels? How are you peeing? Is there any pain, blood? All those stuff. Are you able to see clearly? Are you seeing your dentist? Are you able to hear? So they do that in annual basis, so they can have a baseline of what things are at that time of your annual. And then besides the physical assessment of them, like assessing your physically, they also do something, an annual lab. Annual lab involves taking the blood out and sending it to the lab. This is very, 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 very important, because it is from that blood work that they can find a lot of things and see whether you're falling within the normal range, whether you're very low or whether you're very high. For example, it is from this annual lab, which is the blood, that they can detect your A1C. A1C is what tells us about your blood sugar. Are you normal? Are you pre-diabetic, or are you diabetic? So when they do that, your doctor will tell you where you fall and what you need to do. If you're in pre-diabetic, they will advise you of how to exercise, eat healthy, reduce your sugars, things to help you not to get to the diabetic level. From the same blood work, they can find out about your vitamin D and your calcium. All these things are very essential for your bone growth and bone maturation. They will find about your B12. Your B12 help with your cells and your energy metabolism. And then they can find out about your troponin level. Your troponin is everything to do with your heart. They will find about your potassium, your magnesium. They will find about, in men, the same blood can help figure out your testosterone level, your PCL level, which also help with screening of some cancers, prostate cancer and things like that. And from the same blood, they will look at your thyroid level. We walk around, I'm tired, I'm sluggish, I'm feeling cold, I'm feeling hot, I'm always hungry, I'm always peeing, and my skin is dry, my hair is falling. We have all these symptoms, but we don't do our annual labs. So it's hard to know what exactly is going on. So my recommendation and my push and my encouragement is for you to, if you don't see your doctor on a regular basis, try and do your annual labs. Try and make an appointment with your primary doctor and do your annual lab. From that annual lab work, they can figure out your baseline, and from that your doctor is able to help you maintain your health or prevent or do whatever they need to do to keep you healthy. And so that's what my channel is going to be about. It's going to be about giving those health tips, reminding you of things that you need to do, reminding you of screenings and preventative things that we can do to help our health. So we'll talk about things like screening for the pap smear, for cervical cancer, mammogram, all those things that we need to do. All right, so thank you so much. Keep on subscribing, keep on sharing, and I hope the channel will be helpful to all of us. All right, thank you so much. This is Nelly. I have to run, and then we'll catch up later. Comment, ask questions, share some ideas that you think we should discuss and talk more about. I'm looking forward to hear from all of you guys. All right, thank you so much, and bye bye. We'll talk again later. Okay, bye bye.